The word goiter means enlargement of the thyroid gland. As simple as that. But the reason for the enlargement can be many. And so you have different type of diseases. Let me name a few, like multinodular goiter, Hashimoto's thyroiditis, Dickey-Rovan's thyroiditis, and the list goes on like that. So the retrosternal goiter means not only there is enlargement of the thyroid gland, that enlarged thyroid gland has gone into the chest also. So in this retrosternal goiter, you have 2-3 different types too. I am not going into the details of that. Coming to the patient complaint, the main complaint of the patient, they will be saying that they already know that they have this thyroid gland enlargement and they are regularly consulting their family doctor. And the doctor has already informed them that you have to undergo surgery because of some circumstances. It has been postponed for a long time. So when it goes on like that, the size keeps on increasing. Not only that, they have cough, but there is no signs of infection. And there will be change of voice, which never becomes normal again. And each time when they take something, when they eat, they have a feeling it's getting stuck. They have dysphagia. And when the size increases more, they will not be able to breathe. Even lying down on the bed, lying normally in the bed becomes difficult for them. These are the usual complaints. Now, when you examine the patient, the thyroid gland is huge, occupying almost the whole of the neck. And when you ask the patient to lift up their hand and take in a deep breath and hold like that for a few minutes, what happens is there will be flushing of the face. That is because the hampering of the blood supply. I'll show you a video in which you can see I have marked the whole of the thyroid gland. The lateral side you will not be able to see, and the lower part also I have marked from here to here, and it is extended down. So this patient we had to operate. Now, if you ask me the investigation, what all investigations to be done, we need to do a CT scan. There are so many investigations, but I am being specific to it. So if you ask me, if CT scan, which one is more preferred? Is it CT scan or MRI scan? My option will be MRI scan. There are so many other investigations, like to start with it will be ultrasound, followed by fine needle aspiration, then we'll need a MRI scan, and the test goes on like that. The main investigation for the surgeon, what we need is MRI scan of not only the neck but also the upper chest. Once that is done and we know the extent, we know that it's not only the ENT and the general surgeon, we need help of a thoracic surgeon too. There may be difficulty in intubation also. So the only treatment for such a condition is surgery. I mean to say the whole thyroid gland need to be removed, that is thyroidectomy has to be done. So such type of patients, after surgery, after removal of this huge thyroid mass, even then they may have breathing difficulty if they have delayed surgery, because what happens in such a patient is that the trachea may become soft, I mean the windpipe. So post-operative also they may have problem. So usually before surgery, we will be explaining in detail the complications of the surgery, and after surgery what all problems may be faced. So if you want to know about thyroidectomy, what are the preparations for it, and the surgery, different types, the complications, and how to deal with the complications, and about the home care, if you want to know all about this, in YouTube, enter Dr. Zakir Hussain ENT multinodular goiter, English. There you have at least 5 parts, starting from 1 to 5. In that, you enter part 4, you will know about the surgical steps. So in this video, I have detailed about retrosternal goiter. Thank you so much.